or tuning in the sun. This is TFM. Get ready to rock. From AM to PM. Come on. Let's talk.
TFM 95.4.
Let's talk.
Live on TFM and the TFM Facebook page. This is the live feed of TTV. Let's talk.
Hello and welcome to Outline. These are the headlines for today. His Majesty issues 3 royal decrees. 100-day programs for housing services to continue in Oman. Oman's new labor laws to be in place by April. Quarantine period for arrivals is 7 days, not 14. Those are the headlines for today, and we also have our special segment called Fighting COVID with Madiha Asif. Stay tuned for that, but now let's take a look at the weather. Before we move on to weather, here is our fact for the day. 11% of all global greenhouse gas emissions is caused by humans due to deforestation. And now let's take a look at the weather. An alert has been issued by Oman Meteorology and Civil Aviation Authorities saying that there will be reduction in visibility during fog formation, and there will be mainly clear skies over the rest of the Sultanate with chances of late night to early morning low-level clouds or fog patches over the western parts of Al-Dhahira. And now let's take a look at how the weather will be like in all the governorates. Muscat will be sunny, temperatures between 24 to 16 degrees Celsius. Musandam will be sunny, temperatures between 22 to 14 degrees Celsius. North Al-Batina will be sunny, temperatures between 24 to 15 degrees Celsius. South Al-Batina will be sunny, temperatures between 23 to 15 degrees Celsius. Al-Buraymi will be sunny, temperatures between 26 to 15 degrees Celsius. Al-Dhahira will be sunny, temperatures between 27 to 15 degrees Celsius. Al-Dakhiliya will be sunny, temperatures between 26 to 16 degrees Celsius. North Al-Sharqiyya will be sunny, temperatures between 26 to 14 degrees Celsius. South Al-Sharqiyya will be sunny, temperatures between 23 to 16 degrees Celsius. Al-Wusta will be sunny, temperatures between 26 to 17 degrees Celsius. And Dhafar will also be sunny, temperatures between 23 to 13 degrees Celsius. Welcome back to Outline, and here are the local stories for today. His Majesty Sultan Haytham bin Tariq has issued 3 royal decrees. Royal Decree number 12/2021 reorganizes the Defense Council. Royal Decree number 13/2021 reorganizes the National Security Council. Royal Decree number 14/2021 to conduct military promotions and appointments. The Ministry of Housing and Urban Planning will continue its 100-day programs to improve and accelerate housing services. The ministry stated in its first media meeting that experience of forming 100-day committees has proven a success, and this was evidenced by the results of the initiatives and the ministry that will complete its approach to improving and accelerating its services in order to achieve the highest levels of quality and performance. The program's project and initiatives included the Ministry Executive Plan for 2021. This includes 2 other programs to achieve quick results within 100 days for each program. His Excellency, the Ministry of Housing and Urban Planning, Dr. Khalfan Al-Shuaili, issued Ministerial Decree number 346/2020 on October 5, 2020, regarding the formation of work teams to undertake the study of 10 services tasks provided by the ministry. And the decision stipulated and the results of the work and recommendations are formed, and the team should be submitted within 100 days of the date of issuance of this decision. The new labor and civil service laws are expected to be in place by end of March or first week of April, and aim to create a healthy environment that rewards productivity and instills a culture of productive work, the Ministry of Labor said. Minister of Labor told Oman TV a person should measure the work environment based on productivity and work performed, and there is a plan to unify benefits between the public and private sectors, bringing work closer between the two sectors in terms of salaries, vacations, and working hours, and these will be determined in the new labor law, new labor and civil service, which are expected to be completed by the end of March or first week of April. People cannot choose 14 days of quarantine to avoid a PCR test on the 8th day, a Ministry of Health official said. According to him, it is necessary for travelers to undergo a 7-day quarantine after arrival at the airports with a re-examination through PCR on the 8th day. People who are coming to the Sultanate through its airports must adhere to 7-day quarantine with a re-examination of PCR on the 8th day, and to adhere to quarantine until the result reappears, the official told Times of Oman. He continued, those coming to the Sultanate cannot choose to remain in quarantine for a period of 7 or 14 days, as adherence to the quarantine for a period of 7 days is mandatory. But for those who have been in touch with infected persons, the mandatory quarantine period is 14 days. Those are local stories for today. To talk further more about fighting COVID, let's go to TTV Studio 2 with Madiha Asif.
Thank you, Maitha, for the local updates. In this episode, we'll be talking about the new coronavirus variant that has been making headlines across the globe. In early December, cases of COVID-19 soared in Kent, which is in England, and scientists wanted to know why exactly that is happening. For clues, Nick Lohman, who is part of the COVID-19 Genomics Consortium UK, and his colleagues examined how the coronavirus was mutating. Now, among the Kent cases, scientists found a large cluster that was remarkably different, with a total of 23 mutations arising without prior notice and faster than anyone expected. The National Geographic's Maya Weehas reported in December. Moving on December 23rd, a UK scientist announced a separate coronavirus 2 variant reported in the mid of December in South Africa had now been spotted in 2 people in England. Scientists are still uncertain about how the cluster of mutations arose or what they mean long-term for the virus transmission. According to the detailed report by Maya, one possible hypothesis for their origin involves chronically ill patients treated with experimental therapies like convalescent plasma donated by recovered COVID-19 patients. If you all remember, this was a phenomena that was being also utilized in the Sultanate when people in Oman were getting treated and they were recovering from COVID-19. The ministry and the Supreme Committee in the Sultanate were urging these recovered patients to come and donate blood and the plasma for the patients who are still in the ICU or patients in the worst conditions suffering COVID-19. Now, in such lengthy illness, the virus has more opportunities to replicate, increasing the odds for mutations. The consistent use of the therapies, meanwhile, may put some more pressure on the germ to evolve. Furthermore, according to the Center for Disease Control and Prevention in the USA, information about the characteristics of these variants is rapidly emerging. Scientists are working to learn more about how easily they might spread, whether they could cause more severe illness, and whether currently authorized vaccines will protect people against them. At this time, there is no evidence that these variants cause more severe illness or increased risk of death. Scientists and researchers involved in the developments of COVID says that the virus that causes COVID is a type of coronavirus, a large family of viruses. Now, what happens is that coronavirus are named for the crown spikes on their surfaces. Scientists monitor changes in the virus, including changes to the spikes on the surface of the virus. These studies, including genetic analysis of the virus, are helping both scientists and researchers understand how changes to the virus might affect how it spreads and what happens to people who are infected with it. CDC has lately published on their official website, where they are developing stories and updating people across the globe about the COVID-19, that COVID-19, in fact, multiple COVID-19 variants that are circulating globally. In the United Kingdom, a new variant called B.1.1.7 has emerged within an unusually large number of mutations. This variant spreads more easily and quickly than other variants, according to CDC. Currently, there is no evidence that it causes more severe illness or increased risk of death, as mentioned earlier. This variant was first detected in September 2020 and is now highly prevalent in London and Southeast England. This all information has been posted on the official website of CDC. They continued saying that it has since been detected in numerous countries across the globe, including the US and Canada. Now, in South Africa, another variant called 1.351 has emerged independently of the variant detected in the UK. This variant, originally detected in early October, shares some mutations with the variant detected in the UK. There have been cases caused by this variant outside of South Africa, but it has not been detected yet in the US. Moving on from South Africa, now in Brazil, there is a new variant called P.1 that emerged and was identified in 4 travelers from Brazil who were tested during routine screening at Haneda Airport outside Tokyo in Japan. Now, this variant contains a set of additional mutations that may affect its ability to be recognized by antibodies. These variants, once again, has not been detected in the US, according to CDC. Now, these variants seem to spread more easily and quickly than the other viruses, said CDC, adding that it may lead to more surge and more cases of COVID-19 in future. Now, currently, there is no evidence that these variants cause more severe illness or increase risks of death, as explained by the experts that are working on the developments of the COVID-19, as well as this new variant that is emerging in parts of the globe. However, an increase in the number of cases will put more strain on healthcare resources, led to more hospitalizations and potentially more deaths. Now, rigorous and increased compliance with public health mitigation strategies such as vaccination, physical distancing, use of masks, hand hygiene, and isolation and quarantine will be essential to limiting the spread of the virus and protecting public health. There are also things that we do not know as of now in regard to this variant. But what we know is that scientists are working to learn more about these variants, and more studies are needed to understand A, how widely these new variants have spread, B, how the disease caused by these new variants differs from the disease caused by other variants that are currently circulating, and lastly, C, how these variants affect existing therapies and vaccines. To talk in more detail about this new variant, we have very special joining us, but it's time for a quick commercial break.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to TTV. You're watching Fighting with COVID. And as I said before going on the short commercial break, that we have a very special guest joining us today who will be talking in detail about the new COVID variant. So let's welcome Dr. Suleen Al-Khalili, who is from the Directorate General for Disease Surveillance and Control at the Ministry of Health. Thank you so much, Doctor, for taking up time and joining us for this special episode.
Thank you very much for having me in this interview, inside.
Doctor, I would like to begin the conversation asking you about what is this new variant that the whole world is going crazy and fearing about?
Okay. Before answering this question, in fact, let us clarify certain points. First of all, COVID-19 is the name of the disease caused by the virus, while the virus itself is called SARS-CoV-2. Why is that? Because people, they keep mixing them still until now. So the second thing is that the virus itself, which is SARS-CoV-2, like any other respiratory virus, once get inside the body, it will hijacking certain cells in the body, replicating in the body, i.e. making many copies of itself, spread from one cell to other, then from one person to other. I mean, what happens actually is that the virus gets copied. As the viruses gets copied over the time, over and over, sometimes mistakes could happen. You could think of them like typos, for example. But when mistakes happen in virus, they will never call them as typos, they will call as mutations. So this is mutations. They are basically changes happen in the virus structure. Now, these changes might or might not affect the virus property itself. So mutations per se happened and noticed since the beginning of the pandemic, comparing to the wild existing virus, which was first detected in Wuhan in China. So it is not at all surprising for the scientists that mutations is happening, because simply that's what viruses do. I mean, all the time they are changing themselves in order to maintain their existence. However, majority of these mutations do not cause change in priorities, as I said, with the exception of some of them that give the virus a special advantage, like, for example, increase in transmissibility, which is the ability to spread faster among people and becoming more contagious because of that. And coming back to the question about the fear of the new variants, as per now, there are 3 new variants of concerns, we call them. One was detected in UK, the other one detected in South Africa, the third one in Brazil, and all of them identified by comprehensive genetic sequencing. This is advanced test, kind of test to analyze the virus in order to identify its genomic map.
Right. So, Doctor, thank you for the detail of the virus and also taking us back, with the fact how the virus is and what it's commonly known as. Now, how different is this new variant than the existing virus?
Well, the SARS-CoV-2 virus and the new variants of it, as I said before, it gives the virus advantage. For example, all the 3 variants that have been identified so far, they have increased transmissibility by the mean of increased number of infected people by this variant, increased reported cases. Also, you could notice that they are travelers. I mean, the UK variants reported so far in 50 other countries, the South African variant found in 10 other countries, and the Brazilian variants reported in Japan from a traveler from Brazil. And also here in Oman, we announced the first case of a new variant in a traveler who came from UK. The other things, there are preliminary data suggests that the new variants could be associated with increased risk of death. Whether this is the only contributor or other contributors, affecting this death or not, this is still under study. Also, there are preliminary data that shows that the South African and the Brazilian variants may escape the immune response of the body. That suggests possibility of reinfection in those who got already the infection in the past or those who got the vaccine, in fact. However, as I said, all of those data are only preliminary. Still studies are ongoing and solid information are required before jumping into conclusions.
Right. Doctor, rightly said, you said it right that, these are just preliminary results that have been, going around. And talking about, this new variant, we all know the precautionary measures that one needs to adhere to thanks to the Ministry of Health and the Supreme Committee in the Sultanate, reminding the citizens and residents in the country the precautionary measures to adhere to when it comes to, staying away and preventing oneself from getting infected. How to stay away or how to prevent from getting infected from this variant? What are the precautions? What are the safety procedures regarding to this variant?
In fact, luckily, it's the same way of preventing the pre-existing wild virus, the original virus that was detected in Wuhan. It's the same. There are 2 methods of prevention. The first one is avoiding spreading of the virus itself by the 3 W's, I would call them. Wash hands, wear masks properly, and watch your distance. So commit to the physical distancing of 1.5 to 2 meters, avoid gatherings, avoid crowded places. The second method is the vaccines, because it's, prove itself as a powerful way to protect against COVID-19 infection.
And Doctor, we're still under the, we're still under the effect of COVID-19, not just in Oman, but across the globe. But lately, we have been noticing that, by the grace of God, that the number of cases that are being registered in the Sultanate are decreasing, and the deaths also have been decreasing. In your expert opinion, how would you like to summarize the situation of COVID-19 currently in the Sultanate?
You are absolutely right. I mean, comparing to the global situation in which, as per today, for example, over 100 million infected cases reported with more than 2 million deaths worldwide, our situation in Oman is better, alhamdulillah. In terms that we noticed that there is a decrease in the numbers in all aspects, number of registered cases or reported cases, number of admission, number of ICU admission, number of deaths. Over October, then we got also stable epidemiological curves. However, with the spread of the new variants especially and increased cases worldwide as well as in some of the neighborhood countries, it is not unlikely that we will got increase in number of cases again. That's why we have to keep eye on monitoring the epidemiology situation globally as well as nationally, and to keep vigilant surveillance system. And we have also to maintain and enhance the preventive measures in place.
So is it safe to say, doctor, with this decrease in the number of cases, and you also said the hospitalization and the patients in the ICU, this was also pointed out by the Minister of Health, Dr. Ahmed bin Al-Saidi, in one of the press conferences by the Supreme Committee, that the number of patients in ICU has decreased amazingly, and he still warns people that in fact the number is decreasing, but we still have to be on alert, because this virus can be contagious, and people are now he's actually encouraging people to come forward and get vaccinated. Would you say that with all these things that is happening, that the virus is actually going away from the Sultanate?
Thank you, first of all, very much for bringing this issue up. The answer is no. The virus is still around. It does not disappear. And this is misunderstanding, in fact, and misreading of the dropping in the numbers, which may lead to lapse in the following of the preventive measures, which can be seen in so many aspects by so many people and so many institutes. Be careful, people. The drop in number caused by many reasons and many factors. The most important one is the commitment of the individuals themselves to the preventive measures in place, as well as the multi-sectorial efforts done by the country. And as per the WHO, in fact, they said the new variant is considered as a wake-up call. And now it's kept in the hand of the individuals and the governments to decide how the situation will going to be in the future by implementing the necessary steps to battle the pandemic at this stage. So thank you very much. It is not going. The virus is still around. We have to still be alerted.
Thank you so much, Doctor, for sharing all the details and all the facts, and also advising people and bringing this to light that with the decrease in the number, the virus is still very much there, and people need to be more careful than before. Like you said, the new variant is just like another wake-up call. Last question for you, Doctor, is about the vaccination. You know that the vaccination has been rolled out in the Sultanate. And, in the beginning, there were a lot of reports that people were still a bit skeptical, a bit, fearful in getting vaccinated. So the minister actually came forward, and he was the first one to get the vaccination done, and he assured people that, there are no such side effects. Is there something that you would like to add to that?
I will not just advise people to stop worrying, in fact. In fact, I would advise them to go and get the vaccine as soon as you are notified that you are one of the highest group or one of the priority group, because vaccines are considered one of the best and most effective tool to mitigate the impact of the pandemic. I could visualize the vaccine myself, in my opinion, as a cheap way of getting the immunity, because the other expensive way of getting the immunity is to get the disease itself and the complication, and unfortunately it might reach to death. Nobody wants that. So go and get the vaccine. Whatever rumors you have heard because about the vaccine itself, it doesn't exist. And nowadays, people become more and more aware about the vaccine, the importance of the vaccine. Anyway, the vaccine have proven themselves as an effective tool to eradicate more serious infectious diseases in the past and still until now.
Absolutely. Thank you so much, Doctor, once again for taking up time and joining us for this informative conversation.
Thank you, Madiha, and that is all we have for you today. Tune in again tomorrow at the same time for more midday updates, and thank you for watching TTV.
You've just heard the live feed from the TTV studios on TFM 95.4. Let's talk.